Moving on to the next topic, after we have discussed the pre-prosthetic mouth preparation, where we solved all the problems, other problems related to the oral surgical part, the periodontal part, the endodontic status or the orthodontic status of the teeth. Now the next comes is the major connectors. Now consecutively we'll study all the parts of RPD one by one, starting from major connector, that is the maxillary major connector, which we will cover in this class, then mandibular major connector, then direct retainer, indirect retainer, and minor connectors, right? So these are the 5 important parts, and then following which we'll study the prosthetic mouth preparation, where we'll complete all the major topics, and then remaining few topics will be covered in the further lectures. So without wasting much of time, we'll start with our first, that is maxillary major connectors, right? So now there is very simple thing about major connectors, right? Major connectors are something which contribute the maximum part in the cast partial denture. If you see a cast partial denture, the maximum area will be covered by major connector. So the name itself is saying major connector. So it is something which is major, that is big, and it is connecting. Now what is it connecting? It is connecting the components of one side of the arch to the components of opposite side of the arch. ठीक है. सो लेफ्ट साइड के कंपोनेंट्स से राइट साइड के कंपोनेंट्स का जो कनेक्शन बनता है, दैट इज थ्रू मेजर कनेक्टर. So if I want to define what is major connector, it is a part of removable partial denture which connects the components on one side of the arch to the components on the opposite side of the arch. So if you want to see the diagram over here, suppose this is one side of the arch, this is another side of the arch, here is the midline. So all the components of this side and this side are connected through this metal bar, and that is called your major connector. Okay, simple enough and easy. So if someone asks, or if you are asked, define major connector according to GPT, it is a part of removable partial denture which connects the components on one side of the arch to the components on the opposite side of the arch. Now there are some general requirements which every major connector should have, irrespective of its type. Okay, it can be any type of major connector, but it should have these following characteristics. Okay, so first thing is the rigidity of the connector. Rigidity means it should be strong enough to withstand the stress. It should distribute the stress in a broader area. So broad stress distribution should be present. Broad stress distribution. Okay, why? Because in earlier when we studied the philosophy, where all the components were rigid, it was said that it can broadly distribute the stresses, so that quality of broad stress distribution is necessary, right? It should not be flexible. So what will happen if the major connector is flexible? Suppose if the major connector ends to be flexible, so it will in turn flex all the components. Okay, when it will flex all the components, what will happen? There will be undesirable forces, on your abutment teeth. So when there are undesirable forces on your abutment teeth, it leads to various problems like tooth mobility, tooth loss, resorption of bone or bone loss, inflammation, irritation. Okay, so ultimately it will damage the abutment. So it is very much necessary that the connector between both the sides, the components of both the sides, should be rigid. So when the patient is masticating or biting, it should not bend all the components, which will cause unnecessarily force on the abutment. Okay, so that property of rigidity should be present. It should provide vertical support. Okay, so vertical support is again very much important, right, to the soft tissues. Then it should provide the means of indirect retainer. Okay, so apart from direct retention that is got or provided by the direct retainers, we should also incorporate indirect retainers. That we'll study when we discuss indirect retainers. But right now, as of now, the major connector should also have an indirect retainer attached to it. Okay, it should provide opportunity for positioning the denture base where needed. Okay, so there should be no compromise in placing the denture base. It should be comfortable to the patient, it should not allow any food accumulation, and it should be self cleansing. Okay, so all these requirements should be present. Apart from that, there is a certain requirement that the gingival margin over here, if we talk about the gingival margin, gingival margins are prone to inflammation commonly, right? So that is a sensitive area, so we should keep in mind that our margins of major connector should be at least 6 millimeters away from the gingival margins. Okay, so it's more important that you keep it away, so there is proper cleansing and hygiene maintained, food accumulation is not there, enough place is there so that the area gets self cleaned. Okay, so that is very much important. Second thing, when the any part, okay, suppose a clasp assembly or a rest is going and crossing the gingival margin, it should cross at 90 degrees. Okay, so the occlusal rest arm while crossing the gingival margin, it should cross at 90 degrees perpendicular. It should not be wavy or curved. Proper perpendicular 90 degree is very much important, right? So these two things, firstly 6 millimeters away from the gingival margin, this goes only for maxilla. Okay, when we talk about mandible, it is 3 millimeters away. I'll tell again when we discuss mandible, but right now you can just keep it कि mandible it is 3 millimeters away, maxilla it is 6 millimeters away. Okay, so these two things in the context of protection of the soft tissues. Okay, then next, if we talk indirect retention, we have discussed the proper placement of denture bases and patient comfort should be there. So firstly, when you are placing the margins or anything, smoothened and rounded margins should be present. Smoothened and rounded margins should be present. It should not cause any discomfort. Should not be present, right? Apart from that, if your denture base or any part is going over the palatine rugae, okay, in the palatine rugae area, so in that case you have to keep in mind, suppose if this is the side view, this is one rugae, okay, and on that if I am placing my denture base like this, okay, and in one more case I am placing the denture base margin like this. Okay, so now the anterior margin of your major connector should not slope on the prominence of the rugae. Okay, it should rest on the posterior slope of the rugae. So this is the posterior slope and this is the anterior slope. So the part of rugae should end till your posterior slope only. It should not extend over the rugae and come in the anterior zone. Okay, because it will cause discomfort during speech. Okay, so the palatine rugae should end on the posterior slope of that rugae and not on the anterior slope. So this thing should be kept in mind. 2 points. Firstly, the margins should be round and smooth not cause any discomfort or injury. Second, while crossing the palatine rugae, it should rest on the posterior slope and not on the anterior slope of the rugae. Moreover, when we talk, the major connector should be as symmetrical as possible. Okay, so the major connector should be symmetrical. The left side of the major connector and the right side of the major connector both should almost look alike, right? If there is any palatal tori, in the cases of palatal tori which is inoperable, so in that case you have to provide relief. There are different major connector designs which we'll discuss, so that you can create a section over here and you can relieve that tori which is present in that area. Okay, so that also should be kept in mind. Okay, so these are some of the basic requirements. Okay, we'll go through all the requirements once again. Firstly, rigidity, strong enough, should not flex, then should provide vertical support, should have indirect retention qualities, should place the denture base properly wherever required, should be comfortable, no food accumulation, and it should be self-cleansing. From the gingival margins perspective, it should be 6 millimeters away from the gingival margin for maxilla, 3 millimeters away for mandible. Second, when it is crossing, any part is crossing the gingival margin, it should cross at 90 degrees. Okay, moving on to the margins, smoothen and rounded margins, not cause any discomfort or any kind of injury. Then when ending in palatine rugae, it should end on the posterior slopes, not cross the whole rugae and end in the anterior slope, because the tongue might hit over there or interfere and cause discomfort to the patient. The major connectors should be symmetrical on both the sides, the right and the left side of the arch. Lastly, one more important thing which is there in the consideration is the bead lines. Bead lines. This is a very simple concept. What does it say is, we have to, if I zoom in this diagram, sorry. So if I zoom in this diagram, we can see a beaded kind of extension right over here. That is called beading. Now the whole line in the posterior border of the denture, that line will be termed as bead lines. Okay, now how do you make this bead lines? It is kind of elevation in the denture. So it should be a depression in the cast to make it elevate in the denture, correct? Because it is a replica, right? How much your denture is elevated, that much depression should be there in the cast. So what you do before flasking, you scrape out the posterior border with a round excavator about for 0.5 to 1 millimeters. Okay, scraping on the master cast 0.5 to 1 millimeter. That will lead to formation of beading in the posterior border. Now why this beading is important, right? Because firstly, it will slightly displace the tissues, right? Because that beading is a elevated part, so when the patient wears, it will slightly displace the tissues. Once it is displacing, apart from that, it will also maintain a tight contact or seal. That peripheral seal will be maintained properly. See, like this, a beading will be present in the posterior border. So this is one more last consideration or requirement which is important for the major connectors, right?